Good morning, and thank you for joining today's webinar discussing the newly enacted Cal-OSHA COVID-19 emergency regulations. My name is Natalie Collins, and I'm the Director of Member Relations here at the California Association of Winegrape Growers. COG, Wine Institute, and numerous agricultural associations and commodity groups worked closely in tracking this regulation and submitting comments of concerns. Despite strong objections, these emergency regulations were filed and went into effect on Monday, November 30th. COG is proud to partner with Wine Institute in hosting this webinar to review how this regulation applies to wineries and winegrape growers alike. Joining us from Wine Institute is Tyler Blackney, Director of Legislative and Regulatory Affairs. And from the California Association of Winegrape Growers, my colleague, Michael Miller, Director of Government Relations. Tyler and Michael are going to briefly share with you how we got to where we are today before we turn to the regulation. Now, presenting from Fisher Phillips is Colin Calvert, a partner in the firm's Irvine office, and Brandon Cahoosh, an associate. Fisher Phillips is one of the largest U.S. law firms representing management exclusively in the areas of labor, employment, civil rights, employee benefits, and immigration law. Their team does an excellent job at putting together timely legal alerts, articles, and blog posts on employment and labor law topics. I encourage you to subscribe to their resources at fisherphillips.com to stay updated on current issues. Now, during this presentation, we're not going to be stopping to take any questions. However, I encourage you to type and submit your questions as we go, and we will get to all of them at the end of the webinar. And lastly, we will be recording this webinar, which I will provide to all of you at the conclusion. Tyler will have a link to it, and we also will have it here at COG. So now, without further delay, I'm going to go ahead and turn the presentation over to Tyler and Michael.
Thank you, Natalie, and thank you also to the fine people at Fisher Phillips who greatly appreciate your presentation today. As Natalie mentioned, Tyler and I will briefly discuss how this regulation came to be. Basically, the Occupational Safety and Health Standards Board was petitioned this summer to adopt a COVID-19 workplace standard. The staff at the board recommended against adopting a standard. They felt that the existing IAPP requirements were sufficient and that it was being done under existing law, is being enforced. The staff argued that there was no evidence of widespread problems of people not complying with it. To the contrary, they found that the vast majority of employers were indeed complying, and they felt that the standard wasn't necessary. Nonetheless, in November, they put out a 5-day notice with the language of the standard, allowed for 5 days of public comment, had a 9-hour hearing, and then quickly approved it, giving the Office of Administrative Law 10 days to review, including 5 days again of public comment. And that was approved on Monday, and it took effect on Monday as soon as it was filed with the Secretary of State. It has the force and effect of law, and it is very detailed, which you'll see here in their presentation. Tyler, do you want to add on to that at all, or do you have any more to add?
Sure. Yes, good morning, everyone, and thank you, Michael and Natalie. Again, my name is Tyler Blackney. I'm with the Wine Institute in the Sacramento office, and I will just add first, I just want to say, my heart goes out to everyone struggling through these trying times. As I'm sure you're all aware, we're headed for a new period of stay-at-home orders right before the holiday season, and I know a lot of folks are struggling, but we will get through this, and while it may not seem like it sometimes, there is a light at the end of the tunnel. So with these Cal-OSHA regulations, as Michael pointed out, they were, for lack of a better term, a real ram job, and they were put forward by organized labor attorneys to Cal-OSHA. Businesses were given very little opportunity to provide meaningful input prior to adoption. We, with Wine Institute and COG, provided very extensive comments pointing out many of the fatal flaws in the regulatory language, but Cal-OSHA really had no interest in making changes prior to approving the regs. Again, as Michael pointed out, in less than 3 weeks of the regulations being made public, 17 days, calendar days over the Thanksgiving holiday, the regulations were finalized and put into effect. Again, despite our opposition and the opposition of actually 60+ other business organizations. Now, of course, we all want to protect our employees, the people we work with, and I expect many of you have already gone to great lengths to implement the existing state safety protocols. But these new regs are truly overly burdensome. They are incredibly prescriptive and unable to evolve with the science. And in many respects, as you'll see throughout this presentation, they're unworkable. Today, we are here to talk about compliance, but I can assure you that we, Wine Institute and COG, have not given up the fight, and we are exploring all options. So please, please, please view us as a resource. Don't hesitate reaching out at any time, and thank you for joining. And with that, I'll give back to Michael to introduce our attorneys.
Thank you, Tyler. And I entirely agree. It's a rough time, but we will get through this. So with that, let me hand it over to Colin and Brandon.
Great. Thank you guys so much. We really do appreciate having the opportunity to provide some guidance on this, because rammed through is probably the best description for these regulations. They are complicated, they are detailed, and to the point Michael made, they do carry the force of law, and the weight behind these are potentially very heavy, serious citations from Cal OSHA, who is actively policing and patrolling these Cal OSHA issues, and certainly looking to employers of all different stripes to make examples of. I did briefly want to touch on, before we jump into this, yesterday's order that came down, provide a little bit of clarity on that before we talk through this, because I'm sure that is another issue that is top of mind for the people who are with us today. The order essentially lumps California into multiple regions, and based on ICU capacity, will determine whether or not any of those specific regions go into a 3-week lockdown. I will say that the order itself is relatively straightforward. It is relatively short. It is less onerous than the prior shutdown that we dealt with in the spring. But unfortunately, it is very difficult to know when exactly any ICU area in any particular region is going to hit that 15% level. And once that does happen, it is a 24-hour window before that lockdown of a minimum 3 weeks comes into play. Having looked at the information this morning, most of the regions are somewhere in the 20% remaining capacity. I fully anticipate that over the course of the next week, the entire state will be under a lockdown order, with the exception of certain critical infrastructures and exceptions that are set forth in that order. But that is the timing that I'm looking at. Of course, we put this presentation together not knowing that order was coming down, but all the same, since most of you will continue to operate in some capacity, even in that lockdown, this order becomes all the more important, because it's going to dictate during that period of time exactly how you operate to minimize the spread of COVID-19, which of course everyone's been doing their best to do over the course of the past 9 months, but also to ensure that you are not in a position where Cal OSHA comes out and determines that while nominally you are doing what you can to minimize spread, you are not complying with the letter of these regulations, and as a result have created a serious violation in your workplace, and then are dealing with all of the citations, appeals, and attorney's fees that come along with that. So today we're going to talk through the best approach that we put in place to resolve those issues and to address these specific regulations. Unfortunately, even if we were to leave the whole morning to talk through this issue and to field as many questions as we can, we simply are not going to be able to touch on everything in the level of detail that we need to. At the beginning of the presentation, at the end of the presentation, you guys will see Brandon and my contact information. I encourage you to reach out with any questions you may have, whether that's through COG or reaching out to us directly. We are here to assist however we can. We are always happy to assist any association member who reaches out free of charge with any small questions that we can answer, any clarification we can provide. If it's something quick, if it's something that you want to make sure you understood that maybe I spoke too quickly or we weren't able to discuss in the level of detail you needed, we're always happy to provide that assistance however we can. We know it is an incredibly difficult time. We know that compliance is going to be very tricky here. We've put together resources that we think will help there, but we also know that sometimes a quick phone call or a quick email is the best way to get through that, and we're here to help however we can. So we're going to talk through our compliance blueprint. I'm not going to waste too much time on this slide because we are going to go back through each and every of these things in more detail, but that's our intro. We know it's an uphill battle for everybody. We're going to do what we can to assist, and Brandon's going to tackle our first 4 issues on this. I'll come in on the back end and help do as I can. So Brandon, why don't you go for it?
All right, thank you, Colin, and good morning, everybody. So the first thing we wanted to speak with you about this new emergency temporary standard is who's covered and who's excluded. Now, over the past several months, Cal OSHA has published several general and industry-specific guidance documents related to COVID-19. However, this most recent step in the ETS represents the most significant formal rulemaking action by Cal OSHA to adopt the standard that will be binding and enforceable against all California employers. The new emergency standard applies to all employees, places of employment. However, it does not apply to some of these types of folks. So places of employment with one employee who does not have contact with other persons, employees working from home, employees covered by Cal OSHA's aerosol transmission standard. So in other words, that'd be applicable to generally certain healthcare facilities, laboratories, and others. There's a one-page fact sheet on the Cal OSHA website, which explains a bit more as to who's covered and who's excluded. Though, as Colin mentioned, if you have any questions, we encourage you to reach out to us through the COG employment hotline, and also our contact information, as Colin previously mentioned, will be provided at the end of this PowerPoint as well. So the first major takeaway from the emergency temporary standard, or as I'll call it in shorthand, the ETS, is the written COVID prevention program, or WCPP. The emergency standard requires California employers to prepare, implement, and maintain a written COVID-19 prevention program, similar to the injury and illness prevention programs required by Title VIII of the California Code of Regulations. The standard provides that the newly required WCPP, or written COVID prevention program, may be integrated into an employer's existing IIPP, or illness or injury and illness prevention programs, or maintained in a separate document. The required elements, as outlined by the emergency standard, are as follows. You need to have a system for communicating. There must be an identification and evaluation of COVID-19 hazards. You must investigate and respond to COVID-19 cases in the workplace. You must correct COVID-19 hazards that you identify. You must provide training and instruction to your employees. So this is one's going to require a little bit more work on your part, and we're more than happy to help through providing you with a template PowerPoint you can use to train your employees on the steps you're taking. There's a physical distancing requirement, face coverings, other engineering controls, administrative controls, and PPE, recording, record keeping, and access of information, the exclusion of COVID-19 cases, and the return to work criteria. Although several WCCP elements mirror the IIPPs, many requirements significantly change or expand what businesses likely have encountered or implemented previously. For example, paragraph 1, the system for communicating, requires employers to describe procedures or policies for accommodating employees with medical or other conditions that put them at an increased risk of severe COVID-19 illness. Another just brief example is under paragraph 2, employers with indoor locations must evaluate how to maximize the quantity of outdoor air and whether it is possible to increase filtration efficiency to the highest level compatible with the existing ventilation system. So there are some overlaps between the WCPP elements and the IIPP elements that you had in your plan, and you already have in your plans, but there are some nuances you need to be aware of. So what you should do next is, if you don't already have a current IIPP or COVID-19 prevention plan, you need to act now to get one in place. We have one that's a template one that we'd be glad to tailor to your business needs at a substantially reduced rate. So feel free to reach out to us for that. If you have a current IIPP or COVID-19 prevention plan, you should assess what modifications and additions need to be made. And again, we already have these documents ready to tailor to your needs, so feel free to reach out. Now, the second major takeaway.
And Brandon, just really quick, I wanted to jump in there practically to talk through the WCPP issue that I just want to make sure people are aware of. What typically happens when a Cal OSHA inspector comes out to your workplace, and in this context, it has typically been either an unannounced visit or you receive a letter asking for this documentation, is they want to ensure not only that the policy on paper reads clearly, reads concisely, and complies with the regulations, but it is more important that whoever is responsible for ultimately implementing that policy has a really good handle on the language in there. Because when Cal OSHA does come out, and I think we should assume that whether it is via letter or in person, more and more of these contacts will happen as COVID cases continue to spike over the next few weeks. They will want to be sure that you not only have the policy, but that employees are aware of the policy, and any supervisor who is in a position of responsibility over an employee is familiar with the policy. So not only do you need to have that WCPP, not only do you need to train employees on the steps you're taking, any supervisor needs to be very familiar with this document, because ultimately they will be questioned by Cal OSHA. And if they simply point to the document and can't say that they know the testing requirements, the PPE requirements, all of the other things we're going to go through, you will still find yourself in a position where you will be cited, because the documentation is really just where this starts. There needs to be a clear understanding in the workplace of how that documentation is going to be applied. So wanted to make sure that was clear. Brandon, feel free to jump over to 2.
Okay, thank you, Colin. So the second takeaway is the notice of COVID-19 exposure in cases. In responding to COVID-19 cases, employers must meet several notice requirements laid out in the new standard. Many of these requirements overlap with those in AB 685's notice and reporting requirements. Specifically, the new standard requires employers to give notice of the potential COVID-19 exposure within 1 business day to all employees who've been exposed, their authorized representatives, independent contractors, and other employees, and other employers, who were present during the high-risk exposure period. The high-risk exposure period generally begins 48 hours before the onset of the symptoms or the specimen of the positive test. For those without symptoms, the exposure period is from 2 days before until 10 days after the specimen for their first positive test was collected. So what's the definition of an exposed workplace for the purposes of this rule? The definition of that is any work location, working area, or common area at work used or assessed by a COVID-19 case during the high-risk period. This includes bathrooms, walkways, hallways, and eating areas. Keep in mind that this does not include buildings or facilities not entered by a COVID-19 case. So some major takeaways is when notice is triggered, it is triggered when the COVID-19 case isn't found in the workplace. All COVID-19 cases must be investigated and responded to. So we recommend that you implement these steps. So have a written investigation procedure prepared in advance. Be able to identify when the COVID-19 case was last present. Identify all locations the COVID-19 case was visited in the workplace, and determine who was exposed. Though you must keep in mind that you need to maintain the privacy of the individual who tested positive for the COVID-19 case in order to protect their identity, which is another requirement set forth in this emergency temporary standard. This is a somewhat delicate process, and we encourage you to reach out to us to help strategize the best way to do this. The notice requirements set forth in the ETS provide that you must give notice of potential COVID-19 exposure within 1 business day. So this is a pretty quick turnaround, which makes it necessary to have some templates in place ahead of time so that you can act quickly. All employees who may have been exposed to a COVID-19 case, their authorized representatives and independent contractors and other employers who were present during the high-risk period must receive notice as well. So that'd be a separate type of notice disclosure you'd have to send out. You must maintain employee confidentiality, as I mentioned previously, and you must provide notice to the local health department. So this is another type of notice you should have prepared to send out ahead of time to save time. And you must implement a disinfection and safety plan and provide testing and benefits information to those employees affected. So what you should do next, as I mentioned, have an effective procedure in place to deal with the COVID-19 cases in the workplace. So, for example, investigating, verifying the COVID-19 case status, identifying and recording the COVID-19 cases. As I previously mentioned, have your notices ready ahead of time and in place, and you can just tailor them very quickly and have them ready to go. The third major takeaway is physical distancing. All employees should be separated by 6 feet, except for in these two types of occasions, where you can demonstrate that 6 feet of separation is not possible, or where momentary exposures while employees are in movement is present. So this would happen if the employees are maintaining 6 feet of separation, but when they're passing in the hallway within your office building, that'd be an example of a momentary exposure where you wouldn't have to maintain the 6 feet of social distancing. If you can demonstrate that 6 feet is not possible, then the individuals still need to be as far apart as possible, and you need to be able to demonstrate that. And for fixed locations where it's not possible to maintain physical distancing, you need to provide and install cleanable solid partitions. So that'd be like a clean or like a clear plastic partition that you could put up around the person to shield them from the person next to them. Should also implement cleaning and disinfection procedures. This would include identifying and regularly cleaning touch surfaces like doorknobs, prohibiting the sharing of PPE. I highly doubt your employees are going to be sharing, face masks and whatnot, though if employees share the solid cleanable partitions, you need to have a procedure in place that completely disinfects those before employees pass those off to the next person coming in for the next shift. To the extent possible, you should prevent the sharing of any items such as phones, keyboards, pens, shovels, anything like that. And the sharing of vehicles should be minimized, and high touch points like steering wheels should be disinfected between users. So what you should do next, you should confirm that existing social distancing protocols meet these requirements. You should review the physical layout of your workspace. You should consider a variety of methods of social distancing. So something like staggered work schedules. You should also implement cleaning and disinfection procedures, especially regarding common or shared equipment like steering wheels on trailers or shovels. The fourth takeaway is what you should do regarding face coverings and PPE. So employers shall provide, according to the standard, employers shall provide face coverings and ensure they are worn by employees over the nose and mouth anytime they're indoors, when they're outdoors and less than 6 feet from another person, or when required by a state or local public health department order. So, for example, during a complete shelter-in-place order, like what the governor has put into place, except for essential businesses. So, employees should be wearing their face masks at all times. when in contact or when close to other employees. Bear in mind that face shields are not a replacement for face coverings, but they can be worn together. And the rule is not clear whether or not employees can bring their own PPE or if the employer has to provide it. Hopefully, when there's a more permanent standard put in place, Cal OSHA will further elucidate that requirement, but for now it's ambiguous. So there are a few exceptions to the face covering requirement, such as when the employee is alone in a room while the employee is eating or drinking at the workplace, so having lunch, when employees are wearing respiratory protection, when employees have a medical or mental health condition or disability, or when there are specific tasks that cannot feasibly be performed with a face covering. So what you should do next, you should implement a face covering requirement and communicate it to your employees. You should evaluate, document the exemption requests. So any employee that says that they have a health condition like asthma that they think they should not be having to wear a face mask because of. If an exemption does exist, make sure employees are 6 feet apart or are tested at least twice weekly, and review whether additional PPE is needed. And with that, I'm going to turn it over to my colleague, Colin. Colin, take it away.
Yeah, thanks, Brandon. And on the face covering issue, I've dealt with several of these inspections from OSHA so far. It still appears that they are fine with employees providing their own face masks. And I know that for several reasons, that's preferable. One, securing PPE is difficult now, will continue to be difficult. And two, it's very clear that employees have pretty firm understanding of what face masks they are comfortable wearing. So as long as you have employees wearing face masks, as long as those face masks are covering the nose and the mouth, I think you're in a good place until those regulations change. The real changes that we've seen that I think are more meaningful, certainly, and that will create more headache for employers, have to do with the next two or three that we're going to deal with. The first being exclusions of workers and paid time off. One thing we saw is the day that these regulations became final, the CDC changed their guidance on excluding individuals quarantined in isolation. Important to know that even with the CDC guidance having been limited on this, you are still obligated to follow the Cal OSHA standard because that is the legally enforceable standard. Cal OSHA has issued strict return to work criteria that we're going to walk through, but fundamentally what this boils down to is, strict definitions of new terms that we, didn't necessarily know beforehand, whether that term is return to work criteria, a strict definition of a COVID-19 case, workspace issues that Brandon was discussing. What most folks are going to be dealing with again here is a COVID case defined as an individual who tested positive. It is still possible that there may be public health situations where they order individuals to stay home, to isolate, to quarantine, but 99% of these issues remain COVID cases that are simply positive tests. And the question becomes, how do we deal with an individual who has that positive test, and what are your obligations in terms of keeping them out of the workforce and then ultimately bringing them back? What you'll see on our next slide is Cal OSHA has defined precisely when an individual has to be kept out of the workplace, and they're maintaining that early guidance of essentially a 14-day window. And that 14-day window begins at the date of last possible exposure. Unfortunately, we are still in a position where we need to take an employee's word for it more often than not about when the exposure may have taken place, or outside of knowing that the exposure took place in the workplace, in which case you have a whole different set of problems. But the obligation is that 14-day window, and as Brandon discussed, your investigations, your efforts to track all this information needs to be reduced in writing somewhere, so that if you are ever questioned by OSHA regarding any of these issues, you can clearly demonstrate that you calculated a 14-day window based on a thorough investigation, and that investigation documented. Again, now that we have the 14-day window, that is for an individual who has that COVID exposure, who is COVID positive. What you'll see as we move forward is there are a shifting obligations based on whether that individual ultimately tests positive, or if it's simply someone who's been exposed to an individual who's test positive. And Brandon, if you want to push through, you'll see that during this time off from work, your obligation to continue that employee's pay continues. They have not identified or defined precisely what employee earnings means in the context of this Cal OSHA regulation. I can tell you that for any employee who earns variable pay, whether it's defined as tips or somebody who's on some type of a piece rate, my best guidance is to continue pay based on a 90-day look back. A tipped employee is a little bit different. I think you typically can continue to pay them at their hourly wage because tips are so variable, but certainly somebody on a piece rate should be paid most cautiously on a 90-day average to what they were previously earning. Now, it's a fair question to ask, how does this relate to your obligations under the FFCRA or the California equivalent to continue somebody's pay during a COVID leave of absence? Those obligations are for 80 hours or 10 days of work typically. How I view this Cal OSHA regulation is if an individual catches COVID in the workplace, and that's a key part of the calculation, if it is caught in the workplace, your obligation to pay extends beyond either the federal or the California obligation. So if you had somebody who had to miss more time, if you had somebody who was previously required to stay home and utilize their paid time off under Federal California CARES Act FFCRA, then you have to continue to pay them. They have a new pay obligation under this OSHA regulation. Additionally, if they have to be hospitalized and they miss more than those 10 days that most folks are typically excluded from the workplace, you have to continue to pay unless you can demonstrate that that individual either wouldn't have been working anyway or did not catch COVID-19 in the workplace. That demonstration is a wide open definition. At this point, we do not know precisely how you meet your burden there. The advice that I've given clients time and again on this is, as part of your investigation, you always want to determine whether that person has been in contact with somebody who's tested COVID positive prior to their symptoms or prior to their test, typically somebody in their household, and I see that quite frequently. You'll often be in a position with the first COVID case in your workplace to make that demonstration, to show that that individual did not catch it in your workplace. Very difficult to make that demonstration on the second, third, or fourth individual, because the inference naturally is it is far more likely that they caught it alongside someone they're working rather than back in their house. So Brandon, let's push through on that next one as well. Where are your obligations here on your exclusion? First and foremost, I think it's important to, again, firmly understand your obligations. If possible, put together a flow chart. Make sure you have something on hand so that you understand how your federal, state, Cal OSHA obligations all interrelate to make sure that you're handling this time away from work correctly. Make sure that employees know what the requirements are, what their rights are. These obligations, these emergency standards, California paid leave, they all have notice provisions in them. So employees need to be aware of what their rights are. And the reason for that, is relatively straightforward, at least from Cal OSHA's perspective. If employees are aware of their rights, they might not come into work sick knowing that it could be paid rather than continuing transmission. Takeaway 6 is another one of those issues that has essentially been pulled up from Cal OSHA, and I think an area where I see the most frustration from employers and certainly anybody who's operating to clean up this legislation. It is a very complicated standard to meet. And it is a standard that's based on 3 different situations: one case, multiple case, and then what's defined as sort of a mass outbreak in any workplace. In the event that an employer has one COVID positive 19 case in the workplace, and this is regardless of whether it is a case that was caused from the workplace or a case that came from outside of the workplace, the employer is obligated to offer free COVID-19 testing during working hours to all employees who may have potentially been exposed to that positive case. We determine that exposure by looking at that definition of close contact, a cumulative amount of 15 minutes within 6 feet of an individual over 48 hours. That's what we're looking at when we're making that determination. Cal OSHA doesn't plainly state this, but since COVID-19 testing needs to be offered during working hours, again, my guidance is that is paid time. And most employers aren't capable of bringing somebody into the workplace to conduct mass testing. So that is a paid test that individual needs to be offered. There are also specific notice obligations. These notice obligations are hyper technical and are part of the packet that we've put together because we know the compliance on this is going to be so tricky. But there are precise notice obligations that are triggered that have to go both to employees, to individuals who are on site, and depending on the scope of the exposure and the scope of the spread in the workplace, potentially to local health boards. So there is a lot of obligations that trickle down from that. Presuming that one case were to spread, that you were to have 2 to 3 cases in your workplace, your testing obligations then change, and fairly significantly. As you'll see on our next slide, the testing obligations when you have a multiple COVID tests, and Brandon, we could push through to get to the outbreak piece on this. What you'll see here is multiple and major case outbreaks, and whether that is 3 or more COVID cases over a 14-day period, or what is considered a major COVID outbreak, 20 or more COVID-19 cases over a 30-day period. This is when the testing obligations really begin to kick in. And as somebody who deals with Cal OSHA issues and COVID issues specifically, essentially all day at this point, I can tell you that I'm seeing more and more of what I would at least define as a multiple outbreak situation, if not a major outbreak situation. I'm seeing more and more cases of at least 3 to 6 people in a workplace working alongside each other who are now COVID positive. And Brandon, if you could push back to just those definitions again, because I want to talk through them to make sure we're on the same page for it. Perfect. A multiple COVID infection outbreak, again, is 3 or more cases within a 14-day period. And again, this is that obligation to keep good records, to make sure that you could demonstrate, if you feel that you are not in the multiple situation, you are not in the major situation, specific dates in which you become aware of these tests. So now moving on to that next slide, you'll see when you are in the multiple COVID-19 infection situation, your testing needs to be offered for free during working hours as quickly as possible. The term is immediately, and I know that's a term that doesn't really have any legal meaning, but it does mean as quickly as possible upon you becoming aware that you are within that outbreak definition. And this can be incredibly disruptive. Essentially, if you have multiple employees working in one space, and you become aware, Monday at 9 o'clock that a third employee within that 14-day period has become positive, your obligation is to immediately provide notice to anybody who may have been exposed that they have the ability to take this test. And most frustratingly, you cannot force an employee to take this test. I've yet to see any guidance that says you can mandate the employee takes the test. So from a public health perspective, it's certainly helpful to offer the free testing. I think most people will in fact get a test because the level of concern over COVID-19 is pretty high for the vast majority of the population, but you can't mandate it. So it's entirely possible that you'll have employees who will refuse to take the test and might put themselves at risk, or others. And that's something that is unfortunately outside of your control. That testing needs to be provided again 1 week later and continue on a weekly basis until such a time as you are 0 cases over that 14-day period. So this can be incredibly burdensome for a lot of employers, and logistically impractical for a lot of employers based on where they're located and where their workforce is. It becomes even more complicated when you get to the major COVID-19 outbreaks, because there we're seeing that the testing obligation grows significantly. As we'll see on the next slide, when you have a major outbreak, your obligation is to test twice a week, and potentially more frequently if your local health department mandates it. The most aggressive health departments we've seen, Los Angeles County, certainly Santa Clara, Alameda, have had fairly significant aggressive health department decisions, but that obligation continues during a 30-day period. The testing is going to take place for that extended period of time until it is determined that COVID-19 is no longer an issue in your workplace. So these are heavy, heavy obligations. And they are obligations that trigger, again, these notice requirements that are hyper-technical. And time and again with Cal OSHA, particularly given how overworked they are, what I'm seeing is a letter to an employer asking for information. I'm seeing a 3 to 4 month wait before Cal OSHA ultimately follows up on that request for information. And then I'm seeing very technical questions about specific language, policy, and individuals who might have known, were aware, or responsible for enforcing them. So the devil is in the details here, and it certainly needs to be something that is handled in a very defined way. Let's move on to takeaway 8 to make sure we have enough time on the back end to kind of handle any questions people may have. Again, getting into that return to work criteria, this is where you'll see a standard that is a little bit different than the current CDC standard. But if you have a COVID-19 positive case, there are 3 boxes that need to be checked before that individual can be permitted to return to the workplace. You have the fever issue, you have a general symptom issue, and then you have that 10-day window. The next slide, I think, is ultimately going to be the frustration for a lot of employers. I should say, excuse me, the third slide. Let's go one more, Brandon. Employers are, and maybe it's one more, I apologize for bouncing around a little bit here. Here we go. This is the frustration. Employers cannot require a negative test for an employee to return to the workplace. This is frustrating in two levels for most employers. One, it eliminates your ability to potentially have someone return to the workplace more quickly than the standard laid out over Cal OSHA. You cannot force somebody to secure a test. As a result, your obligation to potentially pay for somebody on a COVID leave of absence extends because you cannot have them come back to the workplace. And the second frustration that I see most often is from those coworkers of a COVID positive employee who certainly want to see that negative test, who want to know, even if they don't actually get to see it, that the individual did in fact report negative before returning to the workplace. Rather, what we're looking at are 10 and 14-day windows, which are transmission windows, which are scientifically solid, but that scientific knowledge hasn't necessarily worked its way into the workforce to where individuals feel comfortable coming back to the workplace knowing that somebody maybe doesn't have that negative test result. As a result of that, there's a real education effort that has to take place within your workplace, letting people know both what you expect of them in terms of sharing information so they can return to work, and what they can expect from an employee who is coming back from a COVID leave, and what they can expect, and what questions they can ask, and educating them a little bit on where the science sits right now so they do feel comfortable coming back to work, knowing that somebody maybe wasn't out 14 days, or somebody returned to work without a COVID negative test. I've certainly seen that risk, seen that frustration, seen that concern in the workplace. It's something that's going to have to be managed moving forward. Let's go to takeaway 9, Brandon, before we open it up for everybody. This is a key issue. Certainly in any agricultural setting, we see very frequently card shares, ride shares, and at times, although typically we are well past harvest season at this point, shared housing. As long as this regulation is in fact, it's really important to understand that your obligation to your employee extends outside of the workplace to these shared spaces. And there are very technical obligations with regard to sanitation, with regard to ventilation, with regard to physical distancing that extend beyond the workplace into a rideshare situation or a shared housing situation. Again, we're looking at things like physical distancing. We're looking at things like screening. We're looking at things like sanitizer. And to prove that you are meeting these obligations, you need more than just a WCPP. You need to have documentation that shows that you are screening riders and drivers. That might mean securing information about their temperature. And if you're marking down that information about their temperature, you're now securing medical information. That triggers a different obligation under California law to make sure that employees are signing acknowledgments and waivers of the CCPA. If you're not securing that information, you need to have a form that nonetheless says they were under 100 degrees at that time. There are all sorts of burdensome record keeping that needs to happen here. If you're utilizing hand sanitizer, you need to maintain invoices that show that you've been making the purchases on regular intervals, because otherwise it's very difficult to prove that they're in place. When we think about housing outside of just transportation, your obligations are slightly different, but the same idea sort of continues. You need to prioritize keeping people in similarly situated situations and workspaces together. You need to do what you can to make sure that those individuals are as best as you can staying in one unit, that they are staying distanced within that unit, and that you are doing everything you can to disinfect. Absolutely critical stuff. At that point, I think, Brandon, that might be the last slide we have that's substantive. And I did want to make sure we left quite a bit of time on the back end to go through some of these things. Again, let's stick on this slide for a little bit. In summary, I appreciate that at best we've done a cursory job of trying to address the many issues that have arisen from this emergency standard. And I appreciate as well the frustration that comes from having operated each of your businesses over the better part of 9 months as best you can to comply with COVID-19, only be told that we're moving the goalpost again. Unfortunately, that is the case. It's unavoidable, and all we can do at this point is what we can to educate, to train, to update policy, to potentially update procedure, and to make sure that all of the efforts that you guys are taking are documented and captured in such a way so that if Cal OSHA comes calling, if there is a workplace outbreak, and more often than not, that workplace outbreak is not a result of your poor practices, but a result of someone's poor decision making. If somebody were to come out, you're as protected as possible, because providing a safe workplace for your employees is not enough under Cal OSHA. You need to do that in a way that is completely buttoned up so that when they come out, they're not in a position to issue you 6, 7 serious citations. And now you're looking at significant liability on top of all of the energy you put into PPE and protection and all of the loss that you've had over the past year because of the downturn in business. And that's our real fear. And that's what we're trying to avoid. So with that, I want to open it up to any questions we may have. Want to encourage you guys again to reach out, whether it's through the hotline, whether it's directly to either of us. We are happy, again, to make ourselves available as best we can, and happy to take as many questions as we can as long as people are staying on.
Perfect. Brandon and Colin, thank you guys very much for that presentation, and thank you for allowing so much time for questions. And we do have a fair amount of questions that have come in, and I'm going to start kind of at the top, simply about face masks, face coverings. Somebody would like to know if they can require their employees to wear face coverings that they provide, or I guess that is the question. Can they require that they wear face coverings provided by the employees? By the employer?
Yeah, it's a great question. 99% of the time, yes. The sole exception to that is going to be an individual who might have a respiratory issue, and potentially the face covering that you're providing, whether it's an N95 or something with a respirator, prohibits them from breathing clearly. At that point, it becomes a reasonable accommodation issue to determine what type of face covering will in fact permit that individual to do their job in a safe way. But broadly, yes. And I understand the impetus behind that, because many people will come to work in face masks that simply aren't face masks, and do very little to eliminate that aerosol droplet spread. So generally speaking, the answer is yes. There's an exception there for individuals who may have medical conditions that preclude them from wearing a company provided mask or PPE.
Thank you. Moving on to the issue of employer-provided housing. If an employee pays rent to live in a housing owned by an employer, is that still considered employer-provided housing? And then is the employer responsible for cleaning and sanitizing daily?
In that situation, no. Unless the housing provided is sort of a bunk housing situation where you pay rent to me, but ultimately what you're paying for is almost a dormitory or a bunk-like situation, that would be a situation where your obligations to clean and sanitize would be triggered. If it's simply an apartment or a single occupancy and somebody has full use and access to that space unfettered, there's no sanitation obligation.
Thank you. And I do want to remind everyone we're getting a fair amount of questions in about whether or not the recording, or we are recording this webinar, and if the slides are available. I do just want to remind everyone that I will provide a link to the recording as well as a PDF of the slides. So the next set of questions, we're getting a lot coming in on testing. So Michael, did you have something to say?
Yeah, just real quickly about housing. We are having conversations with Cal OSHA about what arranged for housing means, because arranged for isn't defined. We have a meeting this afternoon with the CDFA and Cal OSHA. We're trying to get some clarification on some of these housing issues, because it's a little confusing, especially relative to things like hotels and that kind of thing. So we're continuing to work on that.
Thank you, Michael. So this next set of questions all revolves around testing. So a question is, if you shut down your facility for an outbreak, sending everybody home, are you required to pay for their testing?
In that situation, yes. I will presume in that situation that the shutdown of the location is in response to a positive test. If it is in response to a positive test, the regulations are clear. That needs to be free testing. If you are doing this for any other reason, it's a somewhat open legal issue, but the cautious approach, I will tell you, is you should be paying for that testing, because if there's not a obvious COVID reason for doing it, and you're doing it as an internal choice for a policy and procedure that is going to be above and beyond the safety, the cost of that choice should not be borne by the employee. The cost of that choice really should be borne under the employer. And that is not a strict guideline or strict regulation, I should say. That's really a guideline based on the the spirit, and all of the other provisions in place in California under the Labor Code or Cal OSHA.
Thank you. And with the testing, is the employer required to schedule the testing for their employee or simply allow them the time off to get tested?
So the regulation isn't entirely clear there, but the language would say, it does say, I should say, provide free testing. And so I view that as the employer should take the affirmative step of sharing the information about where it's available, allowing the employee to leave work during working hours to get that test. I do not believe that there is an affirmative obligation to schedule that test, because then that puts you closer in the position of mandating the employee take the test, and that's not in the regulation. So my best guidance is you provide notice of where the testing is, you provide notice that the testing is free, and you provide notice to the employee that they can do that during working hours. And the time that they spend taking that test really should be paid time. And you'll see that in some of the guidance we put together, some of the memo work that's interpretive at this point, because again, the guidelines are not crystal in that area.
Colin, and when you said during working time, if an employee is getting tested on their day off, but the employer is still paying them for that time to get tested, are they in compliance, or should they only get tested on their actual work days?
The testing needs to be made available at working times. If there is a reason that that particular employee, or during working hours, I should say, if there's a reason that employee would like to be tested at a later time, at a later date, and you're still willing to pay for it, you've more than met your obligation if it's been made available. If you, quote, make it available, but don't provide the employee with the ability to take the time off during working hours, then you'll find yourself in violation of the statute, or I should say the regulation. I don't think that that's a violation that would result in any real penalty, as long as the testing took place and as long as the employer paid for it.
Okay, thank you for that. And if an employee is home because maybe they were exposed to somebody at work, can the employer require that they still work from home if they are able to? How does that work?
Yeah, and that is unfortunately one of the areas that we have a slide on, and I had to pass through it a little bit to make sure I can answer the question, so I'm glad we got it. In that situation, if an individual can continue to work from home, can work remotely, or can work on site and not near anybody, sort of in a space where they're truly isolated, then you can expect them to continue to work. I mean, obviously, if somebody is symptomatic and cannot work for medical reasons, that's different. But if you're asymptomatic and COVID positive, or if you are otherwise potentially, you were exposed and you're quarantined or isolated, if you can continue to work, you can require that employee to continue to work. The paid leave simply comes into play when the employee cannot work either because of the nature of their job duties or for the medical reasons stemming from the COVID-19 diagnosis.
Thank you. And if an employer, or can an employer request a negative test result before an employee is able to come back to work?
That is no. That is a provision that started in Los Angeles and is now a OSHA provision. In the event that somebody has a COVID transmission case that occurred in the workplace, and I think it's best extended outside of the workplace, you cannot mandate an employee give you that negative test. Instead, you would go by the 10 and 14-day guidelines that are down in the slides, that are down in the regulations, and that, of course, I'm happy to talk through, because sometimes the regulations and the words don't make sense on paper.
Thank you. And obviously with the holiday season, we had Thanksgiving going into Christmas. Are there any requirements that company can put upon their employees if an employee travels out of state?
So this is actually a great question, because it touches on the potential stay-at-home orders that were put in place yesterday by Governor Newsom. Under the Cal OSHA regulations, there's really no standard there. There's no clear guidance. But in the event that any of these regions, go into a lockdown, there is specific quarantine and isolation guidance that is provided in the order about individuals who travel out of state. You can enforce that guidance. You can enforce those orders with respect to your employees. I will tell you that if you enforce that order, you no longer have a Cal OSHA obligation to pay. But since you are advising an employee not to report to work due to potential COVID exposure or travel, your obligation to pay under FFCRA or the California equivalent does get triggered. So if an employee is asked to quarantine after traveling and cannot work due to the nature of their job duties, that is, I think, a very strong argument that the employee should be paid under the federal or California FFCRA and its equivalent.
Thank you, Colin. Discussing the outbreak, I know you guys talked about what constitutes an outbreak for a company. So if a grower, say, has 3 different ranch locations, all 10 or 15 miles apart, and there's an outbreak at Ranch A, and then 2 days later an outbreak at Ranch B, and you reach that outbreak limit, do you have to close down each ranch, or just a ranch that maybe hit the limit?
Yeah, it's a good question. So, the definition of the workplace is pretty relevant there, right? Because each of those different locations would be a different workplace. And 3 cumulative tests over 3 locations is not an outbreak. It would need to be in that specific space. And even within that space, if an outbreak were to occur, the obligation is not to immediately shut down so much as it is to investigate, quarantine and isolate, and provide the free testing. I would say if you find yourself in a position where you have a major outbreak, where you're at that 30-day, 20 or more, then your local health department is very likely going to shut you down. But even then, the decision is not an absolute or a bright line rule.
Thank you. And if an employee has repeated exposure at work and you send them home to quarantine numerous different times, is there a limit on to how much you have to pay them under the emergency paid sick leave?
Under the California Cal-OSHA, if it's workplace, there is no limit. It continues indefinitely.
Okay. Let's see here. We do have a fair amount of questions that have come in. I know we don't have enough time to get to all of them today. However, I will work with Colin and Brandon to hopefully get a FAQ put together with all of these questions, because there are a lot of really good ones. And I do want to remind everyone that Brandon had mentioned that Fisher Phillips has put together a couple documents that they're offering to Wine Institute and COG members at a discounted rate. So they have put together a written COVID-19 prevention plan, as well as a notice packet with a lot of information in it. And Brandon, do you want to touch base on that quickly?
Yeah, definitely. Thank you, Natalie. So Colin and my firm, we've put together all of the templates of all of the certain types of notices that you'll need to provide to all the stakeholders, for lack of a better phrase, involved here. So to employees, potentially infected employees, to the government agencies, all of those, we have those prepared, and we're offering them to COG and Wine Institute members at a substantially discounted rate. We also have the training PowerPoint that you'll need to provide to your employees prepared, and we're offering that at a substantially discounted rate, as well as a memorandum, and that outlines the written COVID-19 prevention plan that it's pretty much a plug and play type of thing that we're offering as well. So if you have interest in any of those documents, please feel free to reach out to Colin and myself, and we'll make those available to you.
Thank you, Brandon. And with that, just also commenting, we have set up a hotline with Fisher Phillips that is available to all COG grower members. You can utilize the services of Fisher Phillips, 20 minutes for free each month. And if you have any specific questions that you want to ask, please utilize that, and I can go ahead and send everybody that information today. So with that, we are coming up on an hour, and I want to make sure that we are timely today. Like I said, we did get a lot of questions typed in our questions tab. So I'm going to work with Michael, Tyler, Colin, and Brandon to get these questions answered and out to you all. So with that, I want to thank Colin and Brandon for your participation today. We know this was a lot of information. We have recorded this webinar, and I will make it available to each of you. Michael, I think you would like to add some closing remarks.
Yeah, I invite Tyler to also add some comments here. While this regulation is law and it took effect on Monday, we are continuing to work with Cal-OSHA, trying to get some clarifications on how they plan to enforce this, about how we should be interpreting the regulation. I think Colin and Brandon pointed out a number of issues where it's not clear exactly what the regulation requires. We want some clarification on that with Cal-OSHA. We want them to come out with some guidance documents that address these issues. They're putting together stakeholder meetings. We have one this afternoon with them. They also have an advisory committee process that's going to begin in January. And we expect that they may do some amendments to the regulation. It's in effect for at least 300 days. We don't know what's going to happen after that. And there's also, you know, a question of, do they really have the authority to adopt this kind of a regulation? And that's a number of people looking at potential legal challenge to that. And Tyler, do you want to comment on that at all?
Not at this time. I mean, we're exploring all options that are available to us, you know, certainly, you know, want to try to make this workable. And I just say, everybody hang in there. I know this is a lot of information. Please feel free to reach out to us at any time, whether it's this, whether it's the new stay-at-home order, or anything else, COVID or non-COVID related. We're here to help. I just want to say thank you for all joining.
Thank you very much. And thank you, Natalie, and everybody else for putting this together. Natalie, hand it back to you.
Yes, all right. So with that, we will go ahead and wrap up. Final reminder, I will send everybody a link to the recording, a PDF of the slides, as well as additional information on how you can contact Fisher Phillips to purchase their written COVID-19 prevention plan and their notice packet. I will send you everything that comes in that and contact information for both Brandon and Colin. So with that, thank you everybody for joining us today, and have a great weekend.
Thank you.
Thank you.